Which brings me to the next topic, talking about family medicine advocacy. I think that us family physicians out there don't do enough to toot our own horn. We have to stand together. We have to try to work together to bring about change. And the change I'm talking about this week has to do in the legislative realm, has to do with what is in the headlines right now politically. And they're talking about the federal budget. They're talking about Medicare cuts. And one of the ways that Medicare cuts can affect family physicians is this way, which I didn't know until I was doing research on this. Training programs, residency programs, they receive their money from the hospital, and the hospital receives money from Medicare. So indirectly, Medicare dollars are paying for residency training. Not just family medicine training, but primary care and also specialist training. So potential cuts in Medicare hospital funds may force hospitals to close residency programs that don't make a lot of money. And of course, that is primary care, family medicine, pediatrics, general internal medicine. And in the blog post I had this week on FamMedRocks13 entitled, What SaveGME Means to Me, I play this out from my point of view as a practicing family physician in small town America. So Medicare dollars are cut, which means that there are less family doctors being trained, which means that when it comes to our practice trying to recruit a new doctor to this small community, it's going to be very difficult to do that. And with other types of Medicare cuts, mainly in doctor or physician payment, those veteran doctors out there, those doctors who have been in practice for decades, they're going to say, hey, we don't need to put up with this anymore. We're going to retire earlier than what we thought because we can't deal with this lack of payment for primary care and family medicine. So I'm in a small practice here in northeastern Ohio, which I've said many times on this show. So as the years go on, and as there are potentially less family doctors being trained, it's going to be more and more difficult for our small practice to survive, to try to recruit people, because everybody knows nobody wants to come to northeastern Ohio to practice medicine unless you live here. The young people out there, they want to go where it's exciting. East Coast, West Coast, down south, not the Rust Belt of America. But I stay here because I grew up here. My family's here. My wife's family's here. We choose to stay here because we want to be close to our families and we want to give back to the communities that have given us so much. But as the years go on, it's going to be more and more difficult. And we're going to be challenged by some of these cuts that the federal government are proposing. And that's what I talk about in my blog post here this week. And I got some of my other family medicine friends to write blog posts about this also. And you can read, I have links to their blog posts from mine, from FamMedRocks13. You know, people like Kevin Bernstein, people like Ben Miller, people like Pat Jonas, people like Jennifer Middleton, some of the leading family medicine bloggers and social media people out there who are giving their unique point of view to these proposed Medicare cuts that are being talked about. So I just had a little bit of an idea that I threw together, within the past week. I put a email together and I sent it out to those people and say, hey, we should try to do something on Twitter to try to raise awareness about this, to try to let people know what could potentially happen with cuts in Medicare. And we just did that, a couple of days ago. You may have seen it on Twitter. You may have not. We used the hashtag SaveGME, which means Graduate Medical Education. And a couple of days ago, we got a lot of people helping us. We had a lot of friends of family medicine helping us, trying to tweet that out, trying to tweet to our blog post to say, hey, if the government goes through with some of these Medicare cuts, it can potentially hurt primary care. It can hurt family medicine. It can hurt citizens of this country getting access to a family physician. And it was pretty good that day. Got some very preliminary, very non-scientific numbers. But for whatever it means, I did get a graphic. I did get some data saying we had 40,000 impressions, which I think is pretty good. We reached about, 12,000 people, according to the data. And that's only with less than 10 people tweeting out. And I was very impressed by that. And I want to thank everybody who helped tweet out our message and trying to get that message out. And that says a lot for advocacy, and not just for family medicine. If you want to try to get your message out there, you just need a core group of people to help you, to help tweet it out, to help come up with a hashtag, to help say, hey, this is what we want to try to say. And I think we were pretty effective. My goal was to try to get the attention of the family medicine establishment and say, hey, social media can be used for things like advocacy, for things like trying to get the message out, whatever that message is. It's not just about traditional media anymore. It's not just about old school media. New media, social media, has a way to get your message out better and quicker and more effective, in my opinion. And hopefully, the family medicine community can come together on some similar issues, especially when it comes to, these national elections coming up this fall and next fall, which are going to be very important to get the message of primary care out there. Because certainly there are some medical groups out there, like the American Medical Association, who everybody knows is specialist-driven, who everybody knows only represents, 10 or 15% of all physicians out there. There are other groups that have to carry the voice of physicians, especially family physicians. And I hope this little experiment that happened this week can at least show the family medicine establishment that there are other options out there to get your message out. And social media, I think, is the best way to do that.